The second quarter is coming to a close today, and the market is trying to keep its rally vibes going in the face of mounting grim news on the COVID-19 pandemic. Here are the stats. Worldwide cases now top 10.4 million with nearly 510,000 deaths. While here in the US, more than 2.6 million people have tested positive for the virus. And as I just mentioned, the news is getting pretty grim. Again, this morning, World Health Organization is warning that the worst of the coronavirus pandemic is yet to come. This comes as more governors roll back reopening plans, and at least 30 states are seeing infection numbers surge. And now Dr. Anthony Fauci, the nation's top infectious disease expert, will be testifying again before Congress today. Dr. Jennifer Ellice is on the front lines and in a Los Angeles emergency room and is seeing the latest surge firsthand. Dr. Ellice, good to see you again. So we talked to you back when this pandemic began. What are you seeing in the hospitals right now? And can you compare and contrast what you're seeing now compared to the start?
Thank you for having me, Brian. What we're seeing right now is an enormous number of people coming back. Our surge capacity is extended. We're starting to see people coming in again with what we know to be, the beginnings of another big surge. So it never really went away for us in Los Angeles County. We had been a hotspot throughout, but I think the rest of the state had maybe started to think that they were that the worst was behind them. But starting about a week ago, we began to see some cases trickling in, and then it started to look more and more like the early days of March.
Dr. Ellice, what the market seems to be, at least from an investor standpoint, is starting to focus on now, I think, is hospital capacity. And I have a good stat here. Houston-based Texas Medical Center, largest in the U.S., 95% capacity. What are you seeing in your hospital right now? Are there enough beds? Is there enough equipment? Are there enough ventilators?
In our hospital, there is. We are having in Los Angeles and in California, we have a little bit of, there's some concern about one of our counties, Imperial County, being overwhelmed. And, our hospital system that I work in, we have been in the past able to move patients around in order to accommodate as we had surges in different areas. I think what's a little bit concerning right now for the entire state and for the entire country is that with the recent openings and elective surgeries going on, this is going to be a little bit more of a challenge than perhaps the beginning of the first wave in March.
Dr. Ellice, Jared Blikre here. Just want to follow up on a point you just made. Elective surgeries, we saw those kind of go by the wayside for several months. Is there any chance that those are going to be canceled again for any intensive purposes here?
I think certainly in some of these hotspots like Houston, possibly in Los Angeles County, I think that those are going to be under review again, especially given the fact that hospitals have ability to move patients around. ICU beds can be extended, ventilators can be extended and moved around from place to place. But staffing is difficult, and especially as some of us become ill from treating these patients, it becomes a challenge in the sense that if we're continuing to operate as normal and doing elective procedures, then there's going to be fewer and fewer resources available to treat these patients. So I anticipate that will probably be re-examined going forward.
Doctor, news just hitting the wires now. The FDA has laid out guidelines for COVID-19 approvals. They only have to be vaccines, that is, 50% better or more effective than a placebo. But when you take a step back, what's the risk here with some of these early vaccines about putting them into our bodies? Should we be putting them into our bodies?
Well, let me just start by saying that vaccines as a whole, there isn't really a concern for putting them in your bodies once they've been approved and tested appropriately. I think that the concern here is that there is a desire all over the world for us to sort of rush some of this research and get a viable vaccine as quickly as possible. I think everyone's sort of pinning their hopes on that, but we can't really. That's not something that I would definitely say by next year is going to be a reality. And given that once all the clinical trials are completed, there is also the question of distribution and acceptance. So these are formidable challenges in and of themselves. Just even if we had a vaccine right now, ramping up production and distribution would be formidable. So to think, I've seen a lot of folks saying that we're going to have a vaccine next year. I think that that's very optimistic, and what the FDA did today makes sense, but I don't think we can really count on that anytime soon.
Dr. Ellis, bottom line is for us, based on what you're seeing in the hospitals and in the spread within families, what's your outlook for the winter? Will we go back to where we were in the spring, or will it get worse? Will it get better?
I mean, every year for us in the medical community, the winter is always a surge and always a challenge. This winter, I think a lot of us are bracing ourselves for what could be one of the greatest challenges of our careers and, in fact, our lives. Because when there is also influenza circulating and all of the other respiratory viruses that affect people, there's going to be a greater need for diagnosis, for testing, for treatment above and beyond potentially what some of these hospital systems can manage. So for the winter, there's concern, but I'm also just concerned for the next couple of weeks because we know that deaths are a lagging indicator. And so from what I'm seeing right now, I think that unfortunately there's going to be a lot of death coming.
All right, let's leave it there. Dr. Jennifer Ellis, good to talk with you again, and please stay safe out there.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.